This is a review of landmark papers on umbilical hernia from the East Landmark Papers online resource. Over the years, mesh repair is proven the gold standard for umbilical and epigastric hernias. The question remains, which mesh should be used? The objective of the MORPHEUS-Trial was to identify a superior method for umbilical and epigastric hernia repair in terms of complications. Complications such as an extended operation duration, additional use of painkillers, reoperation, infection, seroma, extended wound care, extended hospitalization, and early recurrence were reported according to the Clavian-Dindo grading system. The study was conducted as a randomized, controlled, multi-center trial involving 5 teaching hospitals in the Netherlands. All patients greater than 18 years of age with a single symptomatic and primary small umbilical or epigastric hernia measuring 2 finger breadths qualified for inclusion. Incarcerated hernias were also included. Flat pre-peritoneal polypropylene mesh repair with 3 cm overlap was compared with patch repair using the Proceed ventral patch, either pre- or intraperitoneal placement. Non-absorbable monofilament suture was used as fixation of mesh in both groups. 352 patients were randomized, 177 in the patch group versus 171 in the flat mesh group. A significant difference in 2-year postoperative overall complications was seen, mostly occurring in the patch group. This included infection and seroma requiring antibiotic treatment. Additionally, patients had the same rate of pain regardless of the procedure, although required more medication for pain with the patch repair. Reoperation was performed in 19 patch patients versus 7 patients with polypropylene mesh repair. The rationale also included recurrence. However, no significant differences were seen in the recurrences. In conclusion, small epigastric and umbilical hernia repairs using flat polypropylene mesh was associated with lower complication rate than with the Proceed ventral patch repair.